So, back in the late 1990s, Sweden kicked off one of the most ambitious public health projects you've ever heard of. But this wasn't about building shiny new hospitals or discovering some miracle drug. Nope, this was a total redesign of what it even means for a society to be healthy. And it all kicked off with a really fascinating puzzle. I mean, seriously, you'd think Sweden had it all figured out. Their life expectancy was great, and it was getting better every year. So why on earth would they need a revolution? Well, it's because under the surface of those amazing national statistics, there was a huge problem hiding in plain sight. And this lays it out perfectly. While the whole country, on average, was getting healthier, the gap in health between different social classes, the rich and the poor, managers and manual laborers, that gap just wasn't budging. In fact, some of the data showed it was actually getting wider. That was Sweden's paradox. So, how do you fix a problem that decades of progress couldn't seem to touch? The Swedish government realized they couldn't just keep doing the same old thing. They needed a completely new playbook. So, they put together the National Public Health Commission. And let me tell you, its mission was huge. Figure out what was really driving these inequalities, and then build a national strategy to finally get rid of them. Right away, the Commission's first big move was to look for answers where most people weren't looking, outside of hospitals and doctors' offices. Now, this wasn't a totally new idea, but it had never, ever been the absolute central focus of a country's entire health strategy before. And what's so interesting here is that you can really see the learning curve. Sweden had been trying to crack this nut for years. See, they'd learned a tough lesson back in the late 80s with a group that was made up only of experts. It produced some brilliant science for sure, but they couldn't get the politicians to agree on anything, so the whole plan just went nowhere. This new commission, it had to be different. It had to actually deliver. This was the core aha moment, an idea sparked by a famous study from the UK. And it all came down to a really simple but powerful thought. If the things that are really making people sick are stuff like poverty, bad working conditions, or a lack of education, then how could the healthcare system, all by itself, ever be expected to solve the problem? The answer was, it couldn't. So, having learned from those past failures, the government designed this 1997 commission in a totally new way. This thing was built for action, not just for writing reports. And here's the genius of how they did it. Instead of just locking a bunch of academics in a room, they brought everyone to the table. You had politicians from every single party. You had scientists. You had trade unions. You had community groups. This one move ensured that whatever plan they came up with would be a practical, political document ready for prime time, not just another paper collecting dust on a shelf. And the way they worked was just as radical. It was incredibly democratic. They didn't just disappear behind closed doors for 3 years. No way. They'd create a draft, send it out for public feedback, openly debate the priorities. They took the time to build a real consensus. So this wasn't some top-down order from the government. It was a strategy built from the ground up, with buy-in from all over society. And out of this amazing, collaborative, and frankly unique process, the commission landed on an idea so powerful it would become the absolute heart of Sweden's new health strategy. They decided to stop focusing on treating diseases and to start focusing on something called health determinants. It's a fancy term, but it's a simple idea. These are the underlying conditions that make people sick in the first place. Think of them as the causes of the causes. This comparison just makes the shift so incredibly clear. You see, the old way was to set a goal like, let's reduce deaths from heart disease. But the new Swedish way, it was to set goals like, let's increase job security, or let's improve housing conditions. And this completely changed who was responsible for health. All of a sudden, it wasn't just the doctors and nurses. It was every single government department. So what did this actually look like in practice? Well, the final report they delivered in the year 2000 laid out a very concrete plan to build what they called a health-friendly society. Just look at these examples from their final list of goals. I mean, sure, you have a traditional one in there, like reducing smoking, of course. But right next to it, with the exact same weight, are goals to increase employment and reduce poverty. The plan was basically saying that a good, stable job is a public health intervention, that having strong communities is a form of medicine. They were treating economic policy and social policy as health policy. It was a completely new way of looking at the whole picture. When you put all the pieces together, it's so clear that this was a genuine game changer for public health. And its success really came down to a few key, innovative ideas. So why did this work where others had failed? It really boils down to three keys. First, they put the politicians and the experts in the same room, which forced them to come up with a plan that was actually doable. Second, they focused on the root causes, the determinants, not just putting a Band-Aid on the symptoms. And third, they built the whole thing through a democratic process that created real, lasting support. And in the end, this whole Swedish experiment leaves us with a really deep question. It suggests that maybe the things we don't normally think of as medicine, like a secure job, a strong community, or a good education, might actually be the most powerful tools we have to create a truly healthy society for everyone.